Nursing union Denosa is concerned about the number of attacks and what it calls poor safety at public health facilities. It suggested non-negotiable security measures to government following several incidents where intruders gained entry to hospitals as well as clinics. Just last week, a 47-year-old patient was shot dead at Clairwood Hospital in Durban. To discuss this further, we are joined in studio by Cassim Lekhoathi. He's the Acting General Secretary of the Democratic Nursing Organization of South Africa. Good to have you. Thanks so much for coming in.
Thanks for having us, and morning to your viewers.
It's a major concern about security at public hospitals. How often are these breaches and attacks actually happening?
This is going on for a very long time now. Just yesterday, last year, we had an incident in Witbank Hospital, and we tried our level best to engage the Department of Health to address these issues. And we said, till such time they come on board, this needs to be napped on the bud. And here it happened in Clairwood Hospital, where the intruders just got great access into the institution. They caused massive damage undetected, and they left without being traced.
Unbelievable. I mean, if you in terms of surveillance cameras, in terms of the amount of security personnel that are on duty at that time, what are we looking at right now?
One of the things we are calling as a demand, and we are really saying these are very basic demands that the department must adhere to, is the installation of boom gates, have CC cameras, have panic buttons. Because I want to believe if these were installed, these perpetrators would have been traced. And I want to believe up to now, nobody has been found who have committed this atrocity.
So none of these are in place at the moment at most public hospitals?
If not all public hospitals.
That is frightening. I mean, if one thinks about that, just your security the moment you go into a hospital is under threat. There is no protection for you.
And what is also painful is that patients go to the hospital for to be taken care of.
Yeah.
And for families to come and now take their patient as a dead body as a result of as a result of this negligence on the part of the department. Yeah. Leaves very little to be desired.
What has the response been from government? Obviously there hasn't been action, but are they engaging with you? Have they at least made promises to you to say, we're working on it, we're going to up security, we're looking into it? What have they said to you?
Sadly to say that it looks like this is not their interest, this is not their priority. And fortunately, we in the situation in Witbank, the Premier came on board and they've given strict instructions that these things must be implemented. But what we are saying further as Denosa is, take this away from the provincial administration. Let this be a national competency. Because as the employer, it is your responsibility to create a safe environment for all your employees, including the patients. Yeah. We are very compromised as healthcare personnel, our nurses, our doctors. We have heard a lot of stories where nurses were even marked in the institution, in the wards. Other nurses were raped and doctors on duty. And there's nothing. I don't know, well, maybe the government is waiting for a catastrophe to happen.
Yeah. One of the things that we've heard, and the repercussion of something like that, is that night staff has had to now be cut because of the situation and withdraw some of the members from actually working in the evenings. I mean, this must have a dramatic effect on the patients that go there.
We, as a professional organization, our interest is about our members and the patient. And we believe, therefore, our patients are getting a raw deal. To minimize your staff on duty, that is compromising quality health care. And now our nurses, they cannot guarantee safety going to work. They're always concerned. Am I going to work to attend to patients? Am I likely to come back in a body bag? Because the employer is not coming to the party.
Yeah.
Now, when they address these things and the nurses withdraw themselves from the institution, then the employer hide behind the so-called essential services, but they are not providing essential security.
Yeah. Let's just get back to a point that you made a bit earlier, saying that no hospitals in South Africa, no public hospitals, have got adequate security. I mean, the security you are requesting, booms, panic buttons, CCTV, and the likes, security personnel. Are you certain that there is none of that in place in any of the hospitals in the country?
I wish Department of Health could have been here to say, no, Denosa, you're missing the point. In hospital A, B, C, and D, we do have.
Yeah.
From where I am, when I talk to my members and my managers in the provinces, this does not exist. A typical example is Clairwood Hospital. And yes, we want to condemn even the type of security they have on site. We believe, as Denosa further, that insourcing of the security will also be a deterrent to this intruder, because the government will have to employ more security.
Yeah.
Unlike the present situation, for them to get more security, it's more money, which the government will not want to hit.
Yeah.
And that compromises security at all costs. And all what the security guy has with him at the gate, and that was happening in Clairwood, is just have a baton. What do you do to a man who's facing you, pointing a gun at you, and say, do you want to be another stats like the one I've just done now? So naturally, he will give way and then let the man out. And he leaves with no detected, and there's it. Where are they today?
Just finally, as we wrap this up, and I do hope that we get the health department here. The ministry must come in and answer to this, and if they can give us another side of the story and perhaps dispute what you're saying, we welcome that. But staff morale, how is that at the moment? I mean, I can imagine that the situation is dire. Besides the fact that hospitals are in the state that they're in, that the facilities are like they are, the medication is not enough, and patients are struggling. What is the staff going through?
This has a serious impact on staff morale and our members out there, and our non-members, because we represent nurses, are saying enough is enough. Can you come as Denosa, take us out? And we're saying no. The unsafe environment will be the one that will take you out of the institution. And it is on the hands of the department to really address this thing. This concept of them saying we as nurses and doctors are essential services, they must stop hiding behind it, because time for games are over. We were talking real situation, people are dying. The shortage of staff is a major issue.
Yeah.
They are now proposing further to cut because of the so-called the wage bill. And we are saying, as we move into the national health insurance, if you want to achieve that and successful, you will never on a Sunday do that without adequate health personnel on duty. So the issue of shortage of staff, it's critical and must be addressed. The issue of security, beef up security with these demands we have set, and employ more security. That will be a deterrent for the intruders not to gain access into our health facilities and make our health facilities a safe environment.
We have to leave it there, but thanks for coming and talking to us about these concerns. Cassim Lekhoathi, he's the Acting General Secretary of Denosa. They're talking to the lack of security at public hospitals around the country, and also the shortage of staffs and staff morale at this point. So again, that invitation to the National Health Department to come in and respond to this still stands. All right, just gone 8 o'clock here on the program. Sakina, over to you for the news.